How is levothyroxine dosed for hypothyroidism? Imagine waking up one day feeling sluggish, cold, and maybe a bit forgetful. These could be signs of hypothyroidism, a condition where your thyroid gland isn't making enough hormones. When doctors treat this, they often prescribe levothyroxine, a synthetic form of thyroid hormone. But how do they decide the right amount for each person? Let's explore how levothyroxine is dosed for hypothyroidism in a clear and factual way. The starting dose of levothyroxine is usually based on your body weight, age, and overall health. For most adults who are healthy and have no heart problems, the typical initial dose is about 1.6 micrograms per kilogram of body weight each day. For example, if someone weighs 70 kilograms, they might start with around 112 micrograms daily. This dose aims to replace the missing hormone and bring thyroid-stimulating hormone levels back to normal. For older adults or people with heart disease, doctors tend to start with a lower dose, often between 12.5 and 25 micrograms daily. This cautious approach helps prevent any stress on the heart. After starting, the dose is gradually increased every 6 to 8 weeks, depending on how the person responds and their lab results. This slow adjustment allows the body to adapt and helps avoid symptoms of over or undertreatment. Monitoring is key. After each dose change, doctors check thyroid-stimulating hormone levels about 6 to 8 weeks later. This is because it takes that long for the hormone levels to stabilize. The goal is to find the dose that keeps TSH within a healthy range and relieves symptoms without causing side effects. Most adults will not need more than 100 to 300 micrograms a day. Higher doses are rare and might suggest issues like poor absorption or medication interactions. For people who are obese, dosing based on ideal body weight or lean body mass is preferred to prevent overdosing. In older adults, a slightly lower dose may be used to balance effectiveness and safety. It's important to take levothyroxine on an empty stomach, ideally 30 to 60 minutes before breakfast. If you take other medications like calcium or iron, it's best to wait at least for hours before taking levothyroxine, as these can interfere with absorption. Regular blood tests are essential. Your doctor will typically check your TSH levels every 6 to 8 weeks during the initial treatment period. This helps ensure the dose is just right, enough to normalize hormone levels and improve symptoms, but not so much that it causes hyperthyroidism. In summary, levothyroxine dosing for hypothyroidism starts with a weight-based calculation, usually around 1.6 micrograms per kilogram daily for most adults. The dose is then carefully adjusted over time, with close monitoring of blood tests and symptoms. Always remember, individual needs vary, so it's crucial to work closely with your healthcare provider to find the perfect dose for you.